Okay, so as I've just said, this is a session to talk through the government's consultation on its mental health plan. It's planning to publish a 10-year plan, so it's a significant period of time it's looking to cover. So we're really keen to get the kidney voice heard within that consultation. As I said earlier to those of you who were there, I'm Alison, I'm Head of Policy and External Affairs at Kidney Research. And since I joined 6 months ago, it's been really clear to me that mental health is a really big issue for kidney patients. So we're really keen to, work with the government to try and get kidney disease on the agenda in lots of different policy areas, but particularly with mental health. So what's been announced? So a couple of weeks ago, the government published a consultation paper, quite a long document. I don't know if anybody's read it yet. It's about 71 pages, I think, so there's a lot of information in it. You don't have to read it before you respond to the consultation. It might help you get a feel for what the government thinks it's done to date and where its priorities lie going forward, to help you sort of draft your views and your response. But you can respond to the consultation without reading it. So it's entirely up to you how much time you have. And how much motivation you have to read through a long document. So they're looking for the public's views on this document, so anybody can respond. It's an online survey, but you can also respond in writing or sort of on paper if you prefer, and they do give an address to send that to on the website. So if you'd rather not do an online survey, there are other options. The deadline is either the 5th of July or the 7th of July, depending which part of the government website you look at. So I'm working to a 5th of July deadline because that's the earlier one. We don't want to miss the boat. So we have got some time. We have got a few months to respond, and you can go in and out of the survey. So you don't have to sit and do it all in one go. It will save your responses. So that when you log back in, if you're on the same device, the answers you gave up to that point will still be there. So that's quite handy if you've got 10 minutes here, 10 minutes there, rather than half an hour, whatever it might take you. And then the idea is for the government to take into account all the comments and publish a 10-year plan next year. So so consult this year and draft up the plan in the second half of this year and then publish it next year. So that's the time frame. And as I said earlier, as you all know, mental health is a big issue for kidney patients. It's been very clear to me since I joined 6 months ago that it's one of the big issues for people. And we ran a survey at the beginning of the year to sort of gauge the level of mental health symptoms amongst the kidney community and whether or not people were getting support. And the findings were really worrying. So 67% of people who responded, and we had about 1,000 responses, so a significant number of people took part. So 67% said they had experienced symptoms of depression, so that's really high, and that's really worrying. 36% said it had affected their physical health. So we know that kidney treatments are burdensome. And it takes a lot of time and willpower to adhere to things like dialysis. So if your mental health isn't in a good place, then that makes it even more difficult to adhere to those treatments. So it's really important that people do have good mental health to ensure their physical health can stay as good as possible. And then 68% of people said they were offered no mental health support at all. And that's really worrying. That's a huge number of people going without any kind of support, a huge amount of unmet need, and that's the bit we really want to change. So that's our aim, that's our target. The government has said it wants to do 3 things with this consultation. It wants to develop plans to prevent mental health conditions developing. It wants to improve support across the country, and we know that it is a postcode lottery out there. Some people get quite good support from a renal counsellor at the unit. Other people don't get anything at all. So it really is not equitable across the country. And that's really important that changes. And they also want to put mental health and physical health on an equal footing. We know historically that mental health hasn't been given the same focus or the same priority as physical health. It really should do, and it needs to, and they're looking to change that. So in the consultation there are 6 questions for you to answer. So I'm just going to briefly go through them and then focus just on one in a bit more detail. So the first 3 are, how can we all promote positive mental well-being? And it's really interesting to me that this word all is in a lot of the questions, which on one level I suppose is fair enough. You know, we all have a role to play in society in supporting our friends and our families, but actually it's government and NHS who really should be providing that professional specialist support that people need. So I'm a bit torn on whether or not I think the all should be in there, but that's what they've put in there. So if you wanted to comment on that in your responses, then that's fine. So yes, I think there's a certain amount of responsibility they're putting on individuals to promote mental well-being, positive mental well-being amongst, you know, family and friends. Second question is, how can we all prevent the onset of mental health conditions? And one of the things we called for World Kidney Day in March was for everybody to have access to a renal counsellor from diagnosis. And that from diagnosis was really important, because the minute you get that diagnosis, you go on a journey, and your mental health, you know, can deteriorate throughout that journey. But patients tell us that if they have early access to good mental health support, they can share concerns and be reassured. That can prevent, you know, more serious mental health conditions developing. So that's a really important part for kidney patients, is the prevention of any mental health condition. So yeah, that's something we'll be saying within our response to the consultation. Third question is, how can we all intervene earlier when people need support with their mental health? So again, if people aren't picked up at diagnosis by a renal counsellor, if they perhaps decide not to take up the offer because not everybody will want that support so early, but if mental health conditions do develop, then, you know, there needs to be interventions as early as possible. We need the renal team to be looking out for people who do need support, so that, you know, more serious conditions that don't then develop. So they're the first 3 questions. Number 4 is, how can we improve the quality and effectiveness of treatment for mental health conditions? And I think for us that's probably the biggest one. You know, it comes back to the whole renal counsellor, having that specialist support, having access to somebody who knows about kidney disease, who's a specialist in mental health support, can understand what you're going through, can understand what it's like to be on dialysis, knows what drugs you're taking and how they can affect you. That specialist support, I think, is really important for people. Number 5 is, how can we all support people with mental health conditions to live well? And again, there might be views you want to share on that. And then number 6 is, how can we all improve support for people in crisis? And again, for kidney patients, it would be great if people didn't reach that crisis point, if people had early access to specialist support and didn't end up in crisis, but unfortunately that doesn't happen. So, you know, it's important that people can quickly access the support they need if those crises do occur. For each of these questions in the online survey, which I will show you at the end, they ask which subgroups of people you want to comment on, and they split it by age. So one group is infants and parents, the second group is children and young people, third group is working age adults, and the fourth group is older adults. And you can just tick one of those boxes, or you can tick all 4. It's entirely up to you how you want to respond. But yes, as well as sort of writing views in a box, they'll ask you to tick which groups of people you particularly want to respond on. And the other thing to add is that you don't have to answer every question, so you can leave a question blank and just click next. It won't stop you moving on. So if you've got nothing to say on a particular question, you can just skip it. So this question I mentioned earlier about how can we improve the quality and effectiveness of treatment for mental health conditions. So within the consultation document, there's hardly any mention whatsoever of long-term conditions. There's a really small paragraph in the annex at the end, which is really disappointing. It's interesting actually, because we met the Mental Health Directorate in Scotland yesterday, and they published a strategy, a mental health strategy in 2017 that has no mention of long-term conditions in it. They're doing a review of that strategy this year, and they're really keen to talk to charities from, representing people with long-term conditions, because they realise it's a massive omission, it's a massive gap in the strategy. And it's a shame England hasn't twigged that before it published its consultation document, because again, it's a missed opportunity to improve services for this group of people. So that's something we'll be saying very strongly, is that there is this big gap at the moment, not addressing the specialist support for people with long-term conditions. There is quite a lot of talk of IAPT in the consultation document, so improving access to psychological therapies, which was a NHS England initiative a few years ago, and I think that has been quite helpful for people with anxiety and depression. And we hear sort of mixed stories from kidney patients. Some people find it quite useful, but others feel it's too generic and isn't specialist enough for their needs. So I think we're really keen that people do get that specialist support. So we think that IAPT isn't always enough for kidney patients, and they do need more sort of tailored and specialist help. So what we'd like to see, I've already mentioned access to renal counsellor from diagnosis, addressing unmet need as it's called, so people who currently have absolutely no access to support, that needs to change as quickly as possible. And we also want them to look at health inequalities. We know that people from ethnic minority communities and people from deprived areas are disproportionately affected by kidney disease. We know that they also don't access good mental health support as readily as other communities. So it's a double inequality, if you like. So we'll be making that point as well. So yeah, quite a lot to say to the government on this topic. Some of the things you might want to consider when you're responding. So perhaps in advance have a think about how kidney disease has affected your mental health, or that of your family member or friend, whoever you're responding on behalf of. Jot down a few notes. Think about what support you've had or they've had. Has it been what they needed? Was it the right support at the right time? Did it come too late? All those kinds of issues be good to have a think about. If you think mental health conditions could be prevented with the right support, so early access from diagnosis, do you think that could help prevent people deteriorating and experiencing poor mental health? Do you think specialist support is important? Should there be more available, or do you think IAPT is fine actually? Whatever you think, that'd be good to feed in. And then the point about good mental health for good physical health, how strongly do you feel about that? Is that something you'd like to say? In that people with long-term conditions need good mental health in order to manage those conditions and adhere to treatment regimes. So that's some pointers on what you might want to consider before you respond. So at this point, I'll probably go into the survey and just run you through it so you can see what it looks like and see what sort of questions they're asking and how they sort of format it. I'll just quickly go to the other slides before I do, because last time I didn't quite get back to my final slides. So I was just going to remind you that deadline's the 5th of July. We will be reminding people of that deadline over the next few months. So if you're on social media, you should see reminders about the deadline. The new plan is due to be published next year, and our work in this area will continue for the rest of this year. We are looking to do some work with the Centre for Mental Health and we'll be running some focus groups for that. So if you're interested in getting involved in that piece of work, we'd love to hear from you. Okay, so let's just nip back then to the online survey. If you could tell me when you see it. Can you see the survey at all?
Still your slides at the minute.
Okay, might just take a few seconds. Has that come up yet?
Not yet.
You're still seeing my slides?
Yeah.
I might have to stop sharing and then start sharing again and see if that works.
Yeah, we can see it now.
See it now, great, thank you.
Yeah.
So this is what it looks like when you log in. There's some information about the survey, the deadline of the 5th of July, and then if you click next, it starts asking you questions about yourself. So you'll see that it's remembered that I ticked the box saying I was an individual sharing my personal views. If you're a professional, you tick the second box, and then when I come to respond on behalf of Kidney Research, I'll click on this dot here to say we're responding as an organisation. And then you click next. Sorry, I'll go back again because it's probably more helpful if it takes me through the individual route. So then asks you a bit about your personal interest. Are you somebody who's experienced mental ill health? Are you responding on behalf of somebody else? Do you have a personal interest? Would you prefer not to say? So you tick the box that's most appropriate for you. Click next. And then it asks you a bit about yourself, so your age. I'm giving away my age here. And then a bit about whether you're male, female, your ethnicity, where you live. And it's interesting actually because although the Department of Health and Social Care only covers England, it does give you the options to say that you live in the devolved nations on this page. And talking to the Centre for Mental Health, they think that's because there are some aspects of mental health provision that fall outside of the devolved nations health policy, if that makes sense. So most mental health policy is determined by the individual countries within the UK. So Wales decides its own mental health policy, Scotland decides, and Northern Ireland decides its own mental health policy. But there are some aspects of the survey that's a retained policy by Westminster, and therefore you can still respond even if you don't live in England. So it's slightly confusing, but does mean that wherever you live in the UK, you can respond and feed in your views. So it's good to know that everybody can take part. And then it asked you which part of the England you live in. If you clicked England, if you're happy to share your email address with the Department of Health and Social Care, I click no, but I probably should click yes. And then I just nip through to this next bit. So this is where it starts asking you sort of the more substantive questions. So the first one is, how can we help people to improve their own well-being? And this is the section where you tick whether you want to respond in relation to infants and parents, children and young people, working age adults, older adults, and then they do sometimes add an extra box as well. And on this page it's people that are more likely to experience poor well-being. And you can tick as many boxes as you like. It's entirely up to you. You can decide, and then you click next. I'll just show you this page. I won't go through the whole thing, but this is what the boxes look like for you to put in your response, your views. So there are some sort of tick boxes, and then there's a bigger box for you to write some responses, and it will do that for each of the 6 questions. And as I said before, you don't have to answer every question, so you can skip through if you've got nothing to add on that question. So yeah, that's just a feel for what the questionnaire looks like.